Are you curious about the medication called Clopidogrel? Look no further. In this comprehensive guide, we will cover everything you need to know about Clopidogrel, including its uses, dosage, and possible side effects. Whether you're a healthcare professional or an individual seeking information for personal use, this video will provide you with all the key details you need to make informed decisions. Clopidogrel, also known by its brand name Plavix, is a widely prescribed antiplatelet medication that helps prevent blood clots. It is commonly used in patients with a history of heart attacks, strokes, or peripheral artery disease. Understanding how to use this medication correctly is crucial to its effectiveness, and we will delve into the recommended dosages and guidelines. Additionally, we will explore the potential side effects of Clopidogrel, ensuring you have a clear understanding of the risks involved. So, let's dive in and unravel the mysteries surrounding Clopidogrel. What is Clopidogrel? Clopidogrel is an antiplatelet medication that is commonly prescribed to patients with cardiovascular conditions. It belongs to a class of drugs known as thienopyridines and is marketed under the brand name Plavix. Clopidogrel works by preventing platelets in the blood from sticking together, thus reducing the risk of blood clots. This medication is available in the form of tablets and is usually taken orally. It is important to note that Clopidogrel should only be used under the guidance of a healthcare professional, as they will determine the appropriate dosage and duration of treatment based on individual patient factors. Uses of Clopidogrel. Clopidogrel is primarily used to prevent blood clots in individuals who are at risk of heart attacks, strokes, or peripheral artery disease. It is often prescribed to patients who have recently experienced a heart attack or stroke, as well as those with certain conditions such as unstable angina or peripheral artery disease. By preventing platelets from clumping together, Clopidogrel helps to maintain the flow of blood through the arteries, reducing the risk of blockages that can lead to serious cardiovascular events. In addition to its role in preventing blood clots, Clopidogrel may also be used in combination with other medications for certain medical procedures, such as coronary stenting or bypass surgery. These procedures can disrupt the normal flow of blood and increase the risk of clot formation, so the use of antiplatelet medications like Clopidogrel is essential to prevent complications. How does Clopidogrel work? Clopidogrel works by inhibiting a specific receptor on the platelets called the P2Y12ADP receptor. When activated, this receptor triggers a series of events that lead to platelet aggregation and the formation of blood clots. By blocking this receptor, Clopidogrel prevents the platelets from sticking together, reducing the risk of clot formation. This mechanism of action makes Clopidogrel an effective antiplatelet medication that is widely used in the management of cardiovascular conditions. It is important to note that Clopidogrel does not dissolve existing blood clots but rather prevents the formation of new ones. Therefore, it is crucial to seek immediate medical attention if you experience symptoms of a blood clot, such as sudden chest pain, shortness of breath, or weakness on one side of the body. Clopidogrel should be used as part of a comprehensive treatment plan that may include other medications, lifestyle modifications, and regular medical checkups. Dosage and administration of Clopidogrel. The dosage of Clopidogrel can vary depending on the individual patient and their specific medical condition. It is important to follow the prescribed dosage and administration guidelines provided by your healthcare professional. Typically, the initial recommended dose of Clopidogrel for most conditions is 75 mg per day, taken orally with or without food. However, in some cases, a loading dose of 300 mg may be prescribed initially, followed by a lower maintenance dose. The duration of treatment with Clopidogrel will also vary depending on the condition being treated. For example, in patients who have undergone stenting procedures, the recommended duration of Clopidogrel therapy is generally around 1 year. However, for patients with a history of heart attacks or strokes, Clopidogrel may be prescribed for a longer duration, sometimes indefinitely, to prevent further cardiovascular events. It is important to take Clopidogrel as directed by your healthcare professional and not to stop or change the dosage without consulting them first. Suddenly discontinuing Clopidogrel can increase the risk of blood clots, so it is essential to follow the prescribed treatment plan. Possible side effects of Clopidogrel. While Clopidogrel is generally well tolerated, like any medication, it can cause side effects in some individuals. The most common side effect of Clopidogrel is bleeding. This can manifest as nosebleeds, bruising, or prolonged bleeding from cuts or injuries. In some cases, bleeding can be serious and may require immediate medical attention. It is important to notify your healthcare professional if you experience any unusual bleeding symptoms while taking Clopidogrel. Other less common side effects of Clopidogrel include gastrointestinal disturbances such as stomach pain, diarrhea, or indigestion. Some individuals may also experience allergic reactions, which can present as rash, itching, or swelling. In rare cases, clopidogrel can cause severe liver problems or a drop in white blood cell count, which can weaken the immune system. If you experience any of these side effects or any other unusual symptoms while taking clopidogrel, it is crucial to seek medical attention promptly. Your healthcare professional will be able to assess the situation and determine the appropriate course of action. Precautions and warnings when taking clopidogrel. Before starting clopidogrel, it is important to inform your healthcare professional about any pre-existing medical conditions, allergies, or medications you are currently taking. This will help them assess the potential risks and benefits of clopidogrel in your specific case. It is especially important to mention if you have a history of bleeding disorders, liver disease, or if you are taking any other blood-thinning medications. Clopidogrel should be used with caution in individuals who are at a higher risk of bleeding, such as those with gastric ulcers, recent surgeries, or traumatic injuries. Your healthcare professional will carefully weigh the potential benefits of clopidogrel against the risks in these situations. Additionally, it is important to avoid activities that may increase the risk of bleeding while taking clopidogrel. This includes avoiding unnecessary surgeries or dental procedures without consulting your healthcare professional first. It is also recommended to inform other healthcare providers, including dentists and surgeons, about your use of clopidogrel before undergoing any procedures. Interactions with other medications. Clopidogrel can interact with certain medications, potentially affecting its effectiveness or increasing the risk of side effects. It is important to inform your healthcare professional about all the medications you are currently taking, including over-the-counter drugs, herbal supplements, and vitamins. Some medications that may interact with clopidogrel include proton pump inhibitors, PPIs, such as omeprazole and esomeprazole, which are commonly used to reduce stomach acid. These medications can reduce the effectiveness of clopidogrel by inhibiting its activation. Your healthcare professional may suggest alternative medications or adjust the dosages accordingly to minimize any potential interactions. Certain blood-thinning medications, such as warfarin or nonsteroidal anti-inflammatory drugs, NSAIDs, like aspirin or ibuprofen, can increase the risk of bleeding when taken with clopidogrel. It is important to follow your healthcare professional's advice regarding the use of these medications alongside clopidogrel. How to store clopidogrel. Clopidogrel should be stored in a cool, dry place away from direct sunlight and moisture. It is important to keep the medication out of reach of children and pets. Do not store clopidogrel in the bathroom cabinet or near the kitchen sink, as the humidity and temperature changes can affect its stability. If you have any unused or expired clopidogrel tablets, it is recommended to safely dispose of them according to local guidelines or consult your pharmacist for proper disposal methods. Do not flush medications down the toilet or throw them in the trash unless specifically instructed to do so. Frequently asked questions about clopidogrel. Can I drink alcohol while taking clopidogrel? It is generally safe to drink alcohol in moderation while taking clopidogrel. However, excessive alcohol consumption can increase the risk of bleeding. It is advisable to consult your healthcare professional regarding alcohol consumption and any potential risks in your specific case. Can clopidogrel be taken during pregnancy or breastfeeding? Clopidogrel should only be used during pregnancy or breastfeeding if clearly needed and under the guidance of a healthcare professional. It is important to discuss the potential risks and benefits with your healthcare professional before using clopidogrel in these situations. What should I do if I miss a dose of clopidogrel? If you miss a dose of clopidogrel, take it as soon as you remember. However, if it is close to the time for your next scheduled dose, skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. Can I stop taking clopidogrel on my own? No, you should never stop taking clopidogrel or change the dosage without consulting your healthcare professional first. Suddenly stopping clopidogrel can increase the risk of blood clots, which can have serious consequences. It is important to follow the prescribed treatment plan and discuss any concerns with your healthcare professional. Conclusion. Clopidogrel, also known as Plavix, is a widely prescribed antiplatelet medication used to prevent blood clots in patients with cardiovascular conditions. By understanding its uses, proper dosage, and potential side effects, individuals can make informed decisions about their treatment plans. Clopidogrel works by inhibiting platelet aggregation, reducing the risk of clot formation and subsequent cardiovascular events. However, it is important to follow the prescribed dosage and administration guidelines provided by your healthcare professional. Like any medication, clopidogrel can cause side effects, such as bleeding or gastrointestinal disturbances, but these are generally well tolerated. Precautions should be taken, especially in individuals at a higher risk of bleeding or those taking other medications that may interact with clopidogrel. By storing clopidogrel properly and following the recommended treatment plan, individuals can maximize its effectiveness and minimize the risks. If you have any questions or concerns about Clopidogrel, it is important to consult your healthcare professional for personalized advice. Thanks for watching.